Generalized anxiety disorder, also known as GAD, is characterized by persistent and excessive worry about a number of different things. People with GAD may anticipate disaster and may be overly concerned about money, health, family, work, or other issues. Individuals with GAD find it difficult to control their worry. They may worry more than seems warranted about actual events or may expect the worst even when there is no apparent reason for concern. Generalized anxiety disorder affects 2 to 5% of the population, with more women affected than men. Over an individual's lifetime, chances of developing generalized anxiety disorder are as high as 9%. With respect to ethnicity, people with European descent are more likely to be affected than people of non European descent, and anxiety disorders occur more frequently in developed countries than non developed countries. GAD is characterized by excessive uncontrollable worry about everyday things, including social situations. This excessive worry occurs for at least 6 months and often interferes with one's daily life. This worrying can be manifested in physical symptoms including restlessness, fatigue, irritability, muscle tension, and difficulty concentrating and sleeping. The severity of generalized anxiety disorder can vary, with those having the mild to moderate form being able to function socially with treatment, and those who have the severe generalized anxiety disorder finding it difficult to perform simple daily tasks. Causes. As with many mental health conditions, the cause of generalized anxiety disorder likely arises from a complex interaction of biological and environmental factors, which may include traumatic and stressful life experiences, differences in brain chemistry and function, drug or alcohol abuse, genetics, differences in the way threats are perceived, development, and personality. Risk factors. Women are diagnosed with GAD somewhat more often than men are. Therefore, the following factors may increase the risk of developing GAD. Personality. A person whose temperament is timid or negative or who avoids anything dangerous may be more prone to generalized anxiety disorder than others are. Genetics also play another role. Generalized anxiety disorder may run in families. Experiences. People with generalized anxiety disorder may have a history of significant life changes, traumatic or negative experiences during childhood, or a recent traumatic or negative event. Chronic medical illnesses or other mental health disorders may increase risk. Treatment. Treatment decisions are based on how significantly generalized anxiety disorder is affecting your ability to function in your daily life. Mainly, two treatments for generalized anxiety disorder are psychotherapy and medications. Another one is self care. You may benefit most from a combination of the two or three. It may take some trial and error to discover which treatments work best for the person. Psychotherapy, also known as talk therapy or psychological counseling, it involves working with a therapist to reduce your anxiety symptoms. Cognitive behavior therapy is the most effective form of psychotherapy for generalized anxiety disorder. Generally, a short term treatment, CBT, focuses on teaching you specific skills to directly manage your worries and help you gradually return to the activities you have avoided because of anxiety. Through this process, your symptoms improve as you build on your initial success. Medications. Several types of medications are used to treat GAD. Antidepressants, which include medications in the selective serotonin reuptake inhibitor SSRI, and it is used as the first line medication treatments. Also, buspirone and benzodiazepines are also used. Self-care help is the another type of medication like which uses yoga, meditation, physical exercise, relaxation techniques, and stress management. Although anxiety can be daunting, There are many ways to cope with it. First and foremost, it is important to realize that you can't control everything. You must avoid placing pressure on yourself to be perfect in everything you do. Additionally, trying replacing negative thoughts with positive ones. Most importantly, identify what triggers your anxiety and focus on tackling this issue. A helpful tip you can do is by writing in a journal when feeling anxious and then looking back on your journal entries to identify a pattern. There are some small lifestyle changes you can enforce to help cope with anxiety. These include exercising daily, getting at least 8 hours of sleep per night, eating a well balanced meal 3 times a day, and limiting alcohol and caffeine. To cope with an immediate panic attack, it can be helpful to relax your muscles and focusing on slowing your breathing by taking deep and slow breaths. Take control of your thoughts and remind yourself of the times you had overcome your anxiety. Although they are helpful, these tips are often not enough. Do not be afraid to seek professional help through psychiatrist or therapist or counselor and among other mental health professionals.